What a tee up. Good morning. Okay, so let's be honest. How many of you have ever put your glasses down and then forgot where they were? Yeah. How many of you have gone to another room to get something and then when you got there couldn't remember for what? Yeah. Well, chances are that you or we don't have Alzheimer's. But if you have ever wondered just a little bit, you know, how once in a while you think, you know, then you want to sit up and listen up to this presentation. So our speakers today are Patty Wick and Jean Giramonte, and they are volunteers for the Alzheimer's Association. And this is Jean, that's Patty. And what's really special about their presentation is they're not just going to talk about the intellectual parts of Alzheimer's, but both of them spent years of their life taking care of a loved one with dementia. So they're going to talk about what's the real life issues that come up with this, which is one of the things we all wonder about. So I turn you over now to
Jean
Giramonte and Patty Wick.
Thank you, Judy. Thank you, Virginia. And thank you, everyone, for joining us for this Alzheimer's Association program called 10 Warning Signs of Alzheimer's. We're happy to have you here with us. Again, my name is Jean Giramonte. I am a volunteer community educator with the Northern California, Northern Nevada chapter of the association. I've been doing this role for about 4 years now. And my connection to the Alzheimer's Association is through my late husband, Art, who was diagnosed with both Alzheimer's disease and vascular dementia in 2011, and he passed away in 2018. And during those 8 years, I was his primary caregiver. I was also fully employed at a pretty demanding job and trying to balance the challenges of caregiving and working, and eventually was, sorry for that feedback, I learned of the Alzheimer's Association, who gave us tremendous amount of support, both through joining support groups for us and providing additional referrals for resources in the community. We were living in San Rafael at the time. I have since moved up here to Santa Rosa and happy to be a Sonoma County resident. So just a quick comment on the sign-in sheet that I think many of you have already signed up on, the Alzheimer's sign-in form. The reason we use that is because we depend largely on grant funding, and when we prepare applications for funding as a nonprofit organization, we have to demonstrate that we're actually delivering programs like this to the community. So we only ask for a minimum of your name and zip code, which documents that we are presenting this program. If you'd like, though, to add your email or phone number, additional information, so that we can contact you, you can do that as well. But we don't use that form to contact you unless you want to. So I'm going to introduce Patty Wick, who is also a volunteer. She's been doing this longer than I have, so I'll let Patty say hello.
Good morning. I want to thank you all for being here. It sounds weird when you hear yourself through the mic, sorry. Yeah, what better topic to have on a Sunday morning, huh? Let's go listen to someone talk about Alzheimer's and dementia. So thank you all. I have been a volunteer for the Alzheimer's Association for more than 10 years now. I was, before my retirement, I was a elementary school consultant, administrator, and teacher, all in Sonoma County. So I've been trained by the Alzheimer's Association, and I facilitated a support group for over 6 years for people who were dealing with dementia in their families. I've been on the planning committee for the Sonoma Marin Walk to End Alzheimer's for more than 8 years, which is the #1 fundraiser. We'll talk a little bit about that more later. I do presentations. Although we usually do presentations on our own. So Jean and I have never presented together. So this is kind of a new dance for us. And we did something just special for you to weave in our own stories. So I hope it works well. I also facilitate a monthly sing-along group for those with early onset Alzheimer's and their care partners. It's a partnership between the Luther Burbank Center for the Arts and the Alzheimer's Association, and we meet at LBC, and it's near and dear to my heart. I volunteer and I share my story with people like you because I lost both my mother and my mother-in-law to Alzheimer's. They were diagnosed a year apart, and they had the disease simultaneously for over 11 years. They even ended up living in the same memory care community here in Santa Rosa, about 10 minutes from our home. Consequently, I spent a whole lot of time there, and I found that I fell in love with that population. There was something about when I was with people dealing with dementia that you have to be in the present moment. And so it was really a thing of beauty for me to learn that this was a kind of mindfulness that I never expected to get out of it, and one of the silver linings. So with that.
Thanks, Patty. Do you have the clicker for the slides?
No, it's over here.
Okay.
Uh-oh.
I'll
Where
let
is
you
it?
Bring up our. Let's go to our first slide here, or second slide now, I think. Now, these are just some photographs of Art and myself. This was one of the last photographs that I had a beard at the time, so in case you don't recognize me, that's why. But that was one of the last photographs that I was able to get of us before Art passed away. So I was up at Mount Shasta, which you can see in the background, and then you see Patty with her mom and her.
Yeah,
mother.
except it doesn't look like Patty. She had short hair and she was dyeing it then, so it was a few years ago. But on the left is my mother, Doris, and on the right is my mother-in-law, Fern.
Okay, so we will have plenty of time for questions and answers at the end of our program. So if you can save those for then, we'd appreciate it. So today, here's what we're going to talk about. We're going to explore the most common warning signs of Alzheimer's to help you be informed about what is normal aging, like what Judy talked about, losing your glasses or walking into a room. Those are sort of normal aging situations we all encounter. But we're going to talk about what's normal aging and what are signs of Alzheimer's. So we'll describe the typical age-related changes in memory, thinking, and behavior. We'll recognize the common warning signs of Alzheimer's or dementia. And we will discuss the difference between the two terms, Alzheimer's and dementia, so you have that straightened out. We'll go through a process of how we discuss the situation with the person we're concerned about, how to have a conversation with them. We'll get into the importance of early detection and the benefits of diagnosis, talk about what kinds of assessments are done in the medical setting, and then we'll finish with some discussion about what resources are available to the public through the Alzheimer's Association. So we're all here today to learn more about Alzheimer's and dementia and identify common warning signs of the disease. Now, you may have heard the terms dementia and Alzheimer's used interchangeably, and while they are related, there are significant differences between the two. So first, we're going to have a few short video clips in this presentation, and first we're going to hear from Dr. Heather Snyder with the Alzheimer's Association, and she is going to discuss what dementia is.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
Can you hear this computer too? Is it irritating? It's irritating to me.
Is there a way to cut the volume?
I don't know, Jeff. Is this about as good as we can get?
Well, I think if we go back and forth here when we're talking, well, we'll try it.
Okay, if we all start to look a little crazy, then we'll just tell them to stop talking. Did you want to comment on that?
Yes, I just wanted to reiterate that Alzheimer's is the most common form of dementia. So again, just to reiterate, dementia is the umbrella term. It's like a category of diseases affecting the brain or cognition. Alzheimer's being one of many different diseases that qualify as a form of dementia. And Alzheimer's accounts for almost 80% of all dementia cases. So it is the most common, why we spend so much time focused on it. Next, we're going to hear from Dr. Carrillo here, who will talk about what Alzheimer's is and what it is in the brain.
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior.
Over time, and the
brain has three main parts,
can be
the cerebrum, the cerebellum, and the brain stem. Each one plays a
Oops.
Back up. Start her over. I think what happened was we clicked twice on it. That one.
It's important to know what the warning signs of Alzheimer's.
We have a slight conflict between our slides and the system, but we'll get it.
I'm not quite sure where we are. Let's just see.
Can you go back one and then now go forward?
Dementia is the umbrella term
But
for an
she's gonna
individual's
keep
changes
talking.
in memory,
Go all the way
thinking,
back
or
out.
reasoning.
More than
That's
100
fine.
years
Okay.
ago,
There are
Dr.
many
Alzheimer
possible
described
causes
specific
of
changes in the
dementia,
brain.
and
Stop for a second. Now, fast, go one forward.
She's going to talk, I'm telling you.
No, because you went back far enough. Go forward. I'll hit her.
You can't. Okay, we have to power through her though.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
And
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brain stem. Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
We're going to hear from Ruth Drew, another association expert in the area of dementia and Alzheimer's, and she's going to talk about why it's important to know these signs that we're going to talk about.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things. But when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with. Some of the things that can look like Alzheimer's may be other treatable conditions. If it is Alzheimer's, you still want to know as early as possible, because that gives the person and the family time to plan, time to make decisions, and it also gives the person with the disease a voice and allows them to say what they want.
Can everybody hear back there? Thank you. So as we heard, it's important to know the warning signs and to be on the lookout for certain changes. The Alzheimer's Association has come up with a list of 10 warning signs to help people understand the difference between normal aging and common signs of possible dementia. The list is intended to be a tool, not a diagnostic tool, but a tool really to just look at common examples of changes that people experience with dementia. I want to make a point that there's no chronological order to these. People may show some of these signs or none of these signs, not all of them. So it's just common signs. So we're going to go one by one, exploring each of them. And Jean and I are going to kind of weave in our personal stories as we go. So the first one is memory loss that disrupts daily life. One of the most common signs of Alzheimer's, especially early on, is forgetting recently learned information or repeatedly asking the same questions or saying the same things over and over again. This is a picture at the bottom of my mother-in-law, Fern, my son, Darren, my mom, Doris. He was about 15, I think, maybe a little bit older, but they would come over to our house. And I always think of Darren and his patience when I look at this sign and think about repetition, because he would come out from his bedroom and he'd say, "Hi, Grandma. Hi, Nana." And one of them would say, "Darren, my goodness, you're getting so grown up." And he'd say, "Thank you." And the other one would say, "So what have you been doing? What's new?" And he'd tell them. And then he would go into the kitchen and come back into the living room and they say, "Darren, look at you. Aren't you just growing up?" And the other one would say, "What have you been doing?" And I swear, 10 minutes later, they would both ask the same questions. And fortunately, he just answered every time like it was the first time he had ever heard it. So I give him credit for that.
Okay, the second sign we talk about is changes in planning or solving problems. Some people may experience new difficulties in executive functioning, including developing or following a plan or difficulty concentrating. Now, conversely, a more typical age-related change is making occasional errors when managing bills or household finances, things like that. An example I can talk about that's very real with Art. I was still working, as I mentioned earlier. He had already retired before he was diagnosed with Alzheimer's, and he took over most of the household functions, including paying the monthly bills. Well, I started getting calls at work. How come you haven't paid your PG&E bill? Or how come you're late on your bills? And I thought, uh-oh, it's wrong. That's not very characteristic of our household. And I observed Art one day going through the mail, and most of it was ending up in the shredder. He was losing his ability to determine the difference between junk mail and valid mail. So that was one more responsibility I had to take over. So that's just one small example of how this sign can, the problem is you don't necessarily recognize it as anything serious when it happens. At least I didn't at that time. It seemed strange, and we had a discussion about it, and he said, "Oh gosh, I guess I made a mistake." But in reality, he was struggling. So our third sign is difficulty completing familiar tasks. People with dementia often find it hard to complete daily tasks that used to be managed with ease, such as driving to a familiar place, writing a simple grocery list, or remembering how to play a favorite game. Now, conversely, so as we don't worry and we know what's typical age-related, would be occasionally needing help, maybe to use a new piece of technology or to use a microwave oven settings, or how to use some piece of new technology that they hadn't dealt with in the past. That's typical for most of us as we get older. With Art, he was confused quite regularly at one point in determining the difference between a remote control and a cordless phone, as is pictured on this slide. He would try and turn the TV on with the phone and try and talk with the remote. So he was getting them confused. And of course, that caused even more concern with me. But we hadn't yet dealing with it yet. We hadn't dealt with it at that point.
The fourth sign, difficulty, confusion with time or place. Possible signs, having trouble understanding something if it's not happening immediately, or forgetting where they are or how they got there. As opposed to typical age-related change, getting confused about the day of the week, like I did yesterday when I said to my husband, "What day is this anyway?" And he said, "It's Saturday." It's just, well, I don't work anymore, so it's really hard to keep track of those days. I'm going to focus here on becoming confused about where they are and how they got there. And this is a story about my mother-in-law, Fern. She lived and worked in downtown Santa Rosa for probably 50 years. And we got a phone call one afternoon. This is before cell phones. And she said, "I've lost my car downtown. I came to do some shopping, and I've been looking for it for over 2 hours. And some nice lady let me use the phone in her house." And for us, that was the red flag that told us, oh my gosh, we had been seeing some small signs, but this was an indication that we really needed to get some medical advice. So that's a big difference from normal aging.
So our fifth sign is trouble understanding visual images and spatial relationships. Now, some individuals with Alzheimer's or another dementia may experience vision problems, which can then lead to difficulty with balance, trouble reading, and problems judging distance and determining color and contrast, which can all impact driving and navigating the environment around them. Now, vision changes such as cataracts or needing reading glasses, that's a more typical age-related change. So those are things we can accept. But this sign shows us that these changes are not just about memory. It's important to think about all the other ways that someone's daily life may be impacted by any of these changes. Now, examples I can recall with Art were rather demonstrative, actually. It started with, I observed when we were at the dining table, at the dinner table, he would go to reach for a glass of water and the water would be over here, but he would get confused and finally figure out where his hand was in relation to the water glass. Or he would put the water glass on the very edge of the table where it could easily be knocked off. Another thing that was happening within a 3-week period as he drove into, and Art was an excellent driver. He was much better than I was, but as he drove into the garage, twice in a matter of 3 weeks, he knocked the driver's side mirror off on the garage frame. And of course, I wasn't very patient because I didn't know what was going on in his brain at the time. Finally, what he finally owned up one day when I observed him not read. He was an avid reader, and in retirement, he always had 2 or 3 books on his end table, and the bookmarks would move pretty quickly through them, and he just loved reading mostly history books. And I noticed that those bookmarks weren't moving, and he said, well, I can't remember the page that I just read. I keep turning the pages backward. He said, I quit reading. That's when we decided something needed to be done. And we'll talk a little bit later about how that process works. We're going to hear a video from Phil here on this particular sign, which is new problems with words in speaking or writing. Now, individuals may have trouble following or joining a conversation, stop in the middle of a conversation and forget what they were saying, and continuously repeat themselves, as Patty referred to earlier. They might also struggle with finding the right word or call things by the wrong name. They may start using more descriptive terms to identify what they're talking about. For example, they can't think of the word for wristwatch, so they might refer to that as an arm clock or a hand clock or something. You kind of know what they're referring to, but the word wristwatch doesn't enter their thought process. Now, a normal age-related change that we all might experience is occasionally having trouble finding the right word, or, forgetting, oh, what was I going to mention to you? I forgot what I was going to say, and then we usually figure it out later. So let's hear from Phil. Phil is living with Alzheimer's, and he's going to talk a little bit about this warning sign.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, as an avid reader, as a reporter, as a writer. I struggle with them now.
Interesting about that short clip there is that the very thing he's describing happens as he's describing it. He stops for a long pause and then recovers. But he's in the early stage of Alzheimer's. Some people wonder, well, gee, he doesn't look like he has anything wrong. But in the early stage, the signs are not quite as demonstrable.
Number 7, misplacing things and losing the ability to retrace steps. So a person living with Alzheimer's may put things in unusual places, or they may lose things and be unable to go back over their steps to find them. This is not like losing your glasses or your keys and finding them later. This is losing them. They might even accuse others of stealing, which may occur more frequently over time. As opposed to normal aging, misplacing things from time to time and then retracing your steps to find them is what I usually go through. So for this one, I'm going to talk specifically about losing things and not being able to find them, and a person who grows increasingly suspicious of others and starts accusing them of stealing. This is about my mom, Doris. My stepdad, Bob, called me one night and he said, okay, Patty, I don't know what she's doing, but she keeps losing her driver's license, her Social Security card, her Medicare card, all of her credit cards. I've even replaced them all, and she's lost them again. And now she's telling me that she thinks someone's taking them. Well, I wish I had had this information then, because I didn't understand what was going on. They lived 2 hours away, and I was going up there to visit one weekend. So I said, well, I'm coming up next weekend. Maybe I'll take a look around. So we had a good visit. That night, I went to stay in the guest room, which also doubled as my mother's craft room. So she kept all of her stuff in there. And I closed the door that night before I went to bed and started poking around. And I kind of felt a little guilty. I went through all the drawers in the desks, went through the whole desk. It's gone up and down the closet, couldn't find anything. And I sat down on the bed. I have to tell you, first of all, that my mother loved Kleenex. You know, she had matching colored boxes of Kleenex for all the decor in all of the rooms throughout the house. And the reason I tell you that is I finally looked under the bed, and underneath the bed, there were at least 15 boxes of Kleenex. Except these were not filled with Kleenex anymore. She had cut off the tops and stuffed inside all of her important things, letters and cards from us kids and her grandkids, pictures that she thought were important, and of course, multiple sets of all of these cards from her wallet. And she was putting them there for safekeeping. That is not normal aging. And that was the point in my mom's journey when we said we need to get some help. I actually recall sitting on the edge of the bed that night and crying because I thought, this is a turning point in our life. You're not. Push the button again. Maybe I talked too long.
Batteries that might be going dead.
You got it. How are you going to sing?
Hello, hello. Here we go.
There you go. Okay.
Okay, so thank you for putting up with our little technical glitches today. So our 8th sign is decreased or poor judgment. Individuals may experience changes in judgment or decision-making, such as using poor judgment when dealing with money or paying less attention to hygiene and grooming. And this can be especially common in individuals who live alone. Now, making a bad decision once in a while, such as maybe forgetting to get an oil change in the car or things like that, that's a typical age-related change. Again, not to be alarmed. Now, a good example of this, when things began to progress more, Art needed more help getting dressed. Selecting which clothes to wear for certain occasions became a challenge. Putting his pants on backwards at times and starting to cry because he couldn't figure out why they wouldn't stay on when he stood up. He would sit at the bench in front of the bed because there was a big dresser mirror opposite where he could sit and use his electric shaver, and he always used that pre-shave, that alcohol-based pre-shave for electric razors. And he pretty much destroyed the top of the dresser because he was just very careless with that bottle. It would turn over on its side and spill out, and it would, just ruin the finish on the desk, or the dresser. So just all kinds of little things like that can happen because he wasn't capable at that point of understanding how to do certain things, including basically getting dressed. So that's one of those signs. Next is number 9 here, withdrawal from work or social activities. As we age, it's normal to feel a little uninterested by family or social engagements at times. However, someone who is experiencing Alzheimer's or dementia-related changes may start to lose their ability to hold or follow a conversation, and as a result, begin withdrawing from social engagements or hobbies or things that they're interested in. They may lose the confidence to engage in this way. There's unfortunately a certain degree of stigma that still attaches to a form of dementia, and I think for some people that can be an embarrassment. They don't feel as comfortable engaging with others as they once did. Art was a very social person. He was easy with people, but we began to decline more and more invitations to join our friends for dinner engagements or outings, things like that. And what's interesting about that is that it has an impact on friends as well, who don't necessarily, or other family members, people that aren't necessarily around the individual as often as their spouse or caregiver or close family members. And so some people are a little bit uncomfortable being around someone with dementia because they don't know how to communicate easily with them. They realize that there's a barrier there that is hard sometimes for people. So that withdrawal from social engagements was beginning to happen on both ends. We were withdrawing and they were withdrawing. So it left us a little more isolated. And that's where I thank goodness for the Alzheimer's Association, where we had support from individuals going through the same challenge.
You like playing with that thing, I think. Okay. Number 10, changes in mood and personality. Individuals with Alzheimer's or other dementia may become confused, suspicious, depressed, fearful, or anxious. This is a picture of my mother-in-law, Fern. This is a picture from her later stages, but in the early stages, after she was diagnosed, we talked to her about whether or not she wanted to stay in her home, and she really did. She lived by herself out of Bodega Harbor, and she loved it out there. So we did whatever we could to make that last for as long as possible. So there were a couple things that were happening. My husband would go out a couple times a week. He would take meals. He would check around the house, do odds and ends, take her for a walk, come back home. And she also had the fortune of having a couple that lived next door to her that said, it's okay, we'll keep an eye on her. They don't deliver mail, or they didn't at that time, to the houses. And they said, and we'll pick up her mail every day. And we thanked them, of course, and it allowed her to stay in her home. So there was something going on, though, for a couple of months. She kept bringing up a subject about her neighbor stealing her calendar. And she'd get really upset, and then she'd calm down about it. So we didn't take it very seriously. But my husband went out one day to do his visit, and on his way back home, I got a call from the next door neighbor. My mother-in-law was 4'9" and weighed about 95 pounds. She wasn't a huge person, but the next door neighbor was in tears and was hysterical. And I said, what happened? What happened? She said, Fern just came over and she screamed and yelled at me. She told me that I took a calendar, and then she put her hands on me and she said, Patty, I want to help, but I either am going to call the sheriff or you need to come and get your mother-in-law. And it was just one of those heartbreaking situations for us and for her. So I called my husband and I said, you need to turn around. I explained what happened. You need to turn around and go get your mom. And he said, okay. So he packed the bag. She came to live with us for 6 months until we found a place that was appropriate for her placement at that time. And that was the last time she saw her house.
But just to add a quick comment to tail onto what Patty just said, a reminder that Alzheimer's and dementia are not just about memory loss. There are all kinds of behavioral changes that we're describing as well.
I thought you were going to say a diagnosis of Alzheimer's doesn't mean that it's just a diagnosis for the person. It really is a diagnosis for family and friends too, because it impacts so many people. Okay, on to interpreting the signs and deciding next steps. We're going to hear from an expert about this topic. We have to click on that one, I think.
Memory is not all or none, especially when there are early symptoms or signs. So On a good day, people might function very well and not really even, no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people. But they don't have to check up all the boxes.
I think that what he said there at the end about there being a change from their normal functioning is really, really important. The people closest to the person are going to notice it the most.
So it's key that we pay close attention to what's going on with our cognitive health and not dismiss any changes in ourselves or others around us as normal aging. Again, what Patty just said, if it's not a typical behavioral or not typical characteristics of the person, that's when we get more concerned. So many times, as she said, friends and family are the first to notice changes, someone's in memory, behavior, or thinking abilities. So sometimes the person exhibiting symptoms isn't aware or may not have the insight to know that they are experiencing changes, which is why having an outside perspective is critical. With the changes that are going on in the brain, that can explain some of the reason why people's living with dementia don't have that self-awareness anymore to gauge how their own behaviors or thinking or memory changes are affecting them. So this is especially important to have outside perspective for individuals who live alone or are very far from family and friends. You want to take this next? I'll go ahead and introduce this for you. If you continue to observe these changes, it's critical that you plan to take the next step and have a conversation with the person or others close to them about what you've noticed. Now, this can be a difficult or uncomfortable conversation to have, but the Alzheimer's Association has developed this roadmap of 10 helpful steps to help making addressing memory concerns less daunting and more productive. So Patty's going to walk us through this with her own example.
I do have an example. I have a brother, Jack, who's 7 years older than I am. He has one daughter, Jackie. The two of them have always been very, very close. Jackie called me during the pandemic and she said, Auntie Patty, I'm really concerned about my dad's memory. Now, she had watched as her grandmother, my mother, went through dementia, and also her grandmother on the other side went through dementia. So, in our family, there's a little bit of sensitivity. So, I'm going to take you through the steps because we kind of followed this. I asked Jackie, so what changes in memory, thinking, or behavior have you seen in your brother? In your dad? And what are they doing that's causing you concern? And she said, well, my dad, he is always on top of things. He forgot to send a card to his granddaughter, one of my daughters, and he didn't even call. That's just not like my dad at all. Plus, I talked to him on the phone a couple days ago. They were supposed to be going on a trip, he and Louise, his wife. And I said, so what time do you leave the airport? And he said, I don't know. And she said, this is not who my dad is. My dad always knew the itinerary. So she said, I'm just really concerned and I don't know what to do about it. So I said, what else is going on? Because sometimes other stressors or situations, lifestyle changes can be going on. She goes, well, I don't know. I don't see him very often because of the pandemic. We've been apart. So step 3 is what we're doing here right now. We're learning the signs and the benefits of early diagnosis. I asked Jackie if anyone else had noticed any changes in her dad. I said, have you talked to his wife? I'm thinking that that might be a good resource. And she said, you know, they are never apart. I mean, I can't get her on the phone when he's not around her. And she said, you know, they haven't been married that long, so I don't feel like I have a close relationship with her. And I said, okay, I get that. So the next part of this is having a conversation with the person, which doesn't sound like, you know, something you'd really want to do. It's not a fun activity, but the steps really help guide you through it. So did I just, oh, I thought I lost myself. So you might ask, who should be the one to discuss the concerns with the person? A trusted family member, a good friend. It's usually best to speak one-on-one with the person so they don't feel like people are ganging up on them. But you need to know the person well enough to judge what is in their best interest. So I asked Jackie, I said, do you feel comfortable having a talk about this with your dad? And she thought about it and she said, yeah, actually I do. You know, my dad and I have always been really, really close. And I said, okay. So what about a time and a place? And she said, well, we just made a date for a breakfast at our favorite cafe since things are starting to open up again after the pandemic. And she said, we've got this really private booth in the back. She said, I think that would be the perfect spot and time. I said, all right. So the next part was, what do you say? I suggested that she start with something simple like, so Dad, we haven't seen each other in a while. How have you been feeling lately? And maybe follow that up with her concerns that she had observed. So that's what she did. She said, she called me after the conversation and she said, Auntie Patty, I'm just so relieved that I did this. She said, my dad said he's feeling great. He's feeling better than he ever has in his life. And he apologized for missing the birthday. He said they were really busy with some stuff in Louise's family and the pandemic and all of that. But she said, I really got the impression that he was okay. And I said, well, that's great to hear. If you don't get that response and there are concerns, then this is a time that you might offer to go with the person to the doctor. And this is what I told Jackie. Just keep in mind that this might be one of multiple conversations that you need to have with your dad, because maybe other concerns will come up in the future. Next, reach out for support. It's something that I did not reach out to the Alzheimer's Association right away, and I wish I knew that they were there. Now it's like, you know, I wear my Alzheimer's hat and shirt. I didn't today, but everywhere I go and people stop me and ask me questions. And I love it because I just want people to know that help is out there. And it's not just for Alzheimer's, it's for all dementia. And you don't have to have a diagnosis to talk to them at the Alzheimer's Association either. Most importantly, it's just common sense to see a doctor. Like Jean said before, though, there are stigmas attached to this because it's cognitive decline, but it's brain disease. And if you had heart disease, you would go and ask your doctor about it. You kind of have to change your thinking.
Thanks, Patty. So most people do address concerns about memory, thinking, and behavior with their primary care physician first. The Alzheimer's Association makes great efforts to reach out to our healthcare systems and medical community to help them understand why it's important for them to maybe sometimes initiate the conversation with their patients periodically in general examinations and so forth. How they're doing overall, how's your memory, how's your, things of this nature going. But if not, then we need to initiate those conversations with our doctors. And again, most people would start with their primary care physician. Art and I were pretty lucky that we had the same primary care physician for well over 15 years at that point. And while she was not a geriatrician, who's one of the specialties listed on this slide, she did take a special interest in her senior patients. And so and Art himself was in the early stage was aware of the changes that were going on, and he wanted to find out what was going on. So that's not true for everybody. Some people are reluctant to address such a serious concern. They're afraid of getting confirmation that they might in fact have a fatal disease, which Alzheimer's is. So usually an astute primary care physician will refer the person to a specialist, and that's often a neurologist and a neurologist who has experience in memory disorders or issues affecting the brain itself. Not all neurologists are specialists in this arena, so it's important to find someone who is. Now, we were lucky that we got referred because of our primary care physician. She referred us to the Memory and Aging Center at UCSF, which is one of the locally renowned institutions that can address and help people get to the bottom of this. So I'm not going to go into all of these different specialties, but any number of them or all of them could be tapped at some point or another. I see a hand in back. Oh, thank you. Thank you. We got 5 minutes. Okay. So let's go ahead and change to the diagnosis slide.
Do you want to skip through some of these?
Yeah, I think
We'll just have a little sidebar conversation in front of all of you, if you don't mind.
well, I just want to show what's going on with the diagnostic process at this point.
Tell me where to stop.
Keep going. Yes. And one more slide. So here is just a we'll skip the test your knowledge. Well, who here thinks that Alzheimer's cannot be diagnosed? Okay, you're a smart audience. It's an old myth that you can only diagnose Alzheimer's at autopsy. We now have plenty of valid tests, and if you go to the next slide, I'll review just real quickly here. If you're going through a diagnostic process, you're more than likely going to have your standard, medical history. You're going to want someone with you, or you want to attend with the person that you're concerned about to give perspective to the physician, because someone with dementia isn't necessarily able to answer their own questions. But you'll be given a good physical exam. You'll be getting some lab tests. The cognitive status test is very important. It's a series of 30-some questions which help track a person's memory abilities over a period of time. Very simple questions like, name 5 things that are red, name the city you're sitting in. Common questions that we should be able to answer pretty readily, and that helps detect someone who's going through this. And then there is a PET scan, which is very reliable in diagnosing the plaques and tangles that appear in the brain itself. There's also another test that's a little more invasive called a cerebrospinal fluid test, which would be like a spinal tap, which would pick up the remnants of those plaques and tangles in the brain. So that's essentially what you're going to get in a diagnostic process. And
I want to answer this one.
yes, go.
So do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia? I don't know what the next slide is. I guess that was it. Back.
Forward.
There. The answer to this question is no. It could be the diagnosis may be something other than Alzheimer's or dementia. And that's why it's so important to investigate the cause of the symptoms. It could be electrolytes, low blood sugar, nutritional deficiencies, sleep disorders, medications. When I do the presentation with the nurse from Kaiser, she always mentions Benadryl. Infections, urinary tract infections, stress. It could be a lot of things, which is why it's worth going to the doctor. Again, stigma about dementia and cognitive decline can make people put off doing this. So just saying, go to the doctor.
Why don't we go to the final slide, resources, since we're on a time crunch. There we go. So just real quickly here, these are 3 of the primary resources that most people tap into at the association.
You're back.
I'm back. We have a terrific 24/7 helpline at 1-800-272-3900 that is staffed with master's level clinicians and experts in memory and aging issues. It's available in different languages, many different languages through interpretation services, but this is an excellent number for any of you to call if you have any questions or concerns about yourself or someone else, or just want information from the Alzheimer's Association. The online website, alz.org, if you like surfing, it's a very robust website to surf through. You can find out all kinds of information by clicking around and exploring what's going on in the area of research and support and care for individuals and families and so forth. And then the final bullet here is the Community Resource Finder, which I found extremely helpful in finding day programs that ART could attend, transportation services, food delivery services, long-term care facilities, any number of local resources. The Alzheimer's Association can be your clearinghouse, if you will, to identify those. So with that, we're going to open it up to questions and answers. Virginia has a microphone, and I think so
And
does.
Lynn has a
Ben.
microphone over here. So we're going to go back and forth. Just raise your hand and we'll get a microphone over to you. And here's our first question.
That was good.
So I have a dear cousin who has been diagnosed with Alzheimer's. And in her early stages, she was diagnosed right before COVID hit. She didn't even recognize her own husband, and they were married for over 50 years. I'm sorry. She didn't recognize her own husband. She thought that he was an intruder and several times called the police. Is this a common sign?
Yes, it can be. In fact, Art called the police on me one time, dispute about the breakfast that I served him. I'm sorry, this keeps backing in and out, but if he was hurt, and he thought I was his prison. Yeah, he thought he was in prison and that I was keeping him in prison because, of course, when you're caring for someone, you have to take charge. And there are just all kinds of emotions that someone with Alzheimer's or dementia might have, like paranoia, suspicion, fear, anxiety, all kinds of things. So that is not uncommon, Steve.
Hi, you mentioned Benadryl. I was wondering if you could go into more of the relationship.
I think it's just something to ask your doctor about if you're having symptoms.
Jean, when you're speaking, hold it like this.
We're getting microphone training today.
I recently read that the DMV is changing some of the rules for senior citizens. And that one of those things was that doctors would be where they had to report if they get a diagnosis of Alzheimer's to the DMV. Is that true?
That is absolutely true. And I attended a webinar with the DMV to learn more about this not too long ago. And The process is that the doctor is required, if a diagnosis is made of Alzheimer's or other types of dementia, they are required to report that to the DMV. At that point, the DMV will give the individual a chance to come in and prove whether or not they can continue to drive safely. And then they will be monitored. If their license is continued, they will be monitored more closely to return to the DMV for periodic verification. Otherwise, their license will be suspended.
Is it hereditary?
Where are we?
I can't see.
Is
Can you
it
just-
hereditary? Well, not,
There are three risk factors, three main risk factors: age, family history, and genetics. Of those three, the main risk factor is age. After the age of 65, 1 out of 3 people. Is that correct, Shelley? 30%. So if you're sitting next to 2 other people, the odds are not really good. And it's worse for women. So I'm up here saying it's just not fair. So that is a risk factor, and something that you could talk to your doctor about.
there
Excuse
are
me.
some, I'll just add, there are some deterministic genes that some people do inherit that are quite predictive that they will develop Alzheimer's. But that's not most people don't go through genetic testing to figure that out.
Thank you. And could you please repeat again? 1 is age, 3 is genetics, and
Family history.
family history. Thank you.
Yes.
My thing is, I'm dealing with a friend who's got Alzheimer's now, and I took her to a primary care doctor months ago. He asked her a few questions, and he said, she's fine, she can live at home. And I was like,
Oh,
shocked.
I was going to add in a comment when you were talking about doctors, because what worked best for me with both of my moms is documenting everything that I had seen, or my brothers had seen, or anyone had seen. And I sent that to the doctor ahead of time. Then it was part of the medical record. The doctor had it when we went into the office, because when we went into the office and it was a 10-minute exam, the doctor would say, no problem here.
I had called the doctor's office and left a message for all the problems.
I would document it in writing. Yeah.
I had a question. I had a partner who got Alzheimer's, and we had gone to Kaiser, and within 20 minutes after they gave him a test, they said that he had Alzheimer's, and they immediately contacted the DMV, and he lost his license. And I just feel that's a much too quick diagnosis, and that a lot of people are not going to want to go get help because you're going to lose your license.
Yes, that's a, I couldn't see who was talking. I was looking back there. Thank you. That's a good question. And lost my train of thought there for a second. Normal aging. The diagnosis has to be done properly before they can report to the DMV. So what if the scan had been done to show the existence of these amyloid plaques in the brain? That is what a true diagnosis is based on. So if a doctor's reporting prematurely, that would not be appropriate. And yes, you're right. Some people do have a hard time, confronting the fact that they may not be able to drive anymore, because driving is freedom in our society, and we need the ability.
Driving is one of the hardest things to deal with.
Are there effective drugs for Alzheimer's?
Well, I'll try and make this fairly brief. Up until 2 years ago, the only medications available, like Aricept or
Namenda.
Namenda, those kinds of drugs, only address the symptoms of the disease and not the underlying biology. So things like memory loss or confusion or concentration or mood disorder, medications can help with those symptoms. 2 years ago, the first medication was approved by the FDA called Aduhelm, which is the breakthrough drug that addresses the actual plaques in the amyloid plaques in the brain and has shown effectiveness in slowing down the progression of those plaques. It doesn't stop it, it doesn't cure the disease, but it is showing promise in a type of action that it has. And then just last year, another medication called lecanemab was developed, which is even more promising than Aduhelm and doing the same kind of effect on the underlying biology. And just real quickly, the Alzheimer's Association is very much engaged right now at the legislative level and at the Washington, D.C. level to convince Medicare to change their position. Medicare has said that you cannot be eligible to take those medications, which are quite expensive and can only, the last two that I mentioned, that address the underlying biology. They're expensive, they have to be administered by infusion, which means intravenously on a monthly basis. And the Medicare has said that they will only approve patients who are already in clinical trials, which really reduces the number. Hope that answered your question about medication.
Thank you for being here. I have a friend and she was diagnosed with shrinking brain. And then she's had some tests and then the physician has referred her to a specialist, which she can't get into for 8 months. Her doctor told her to stop drinking, which she's not going to do, but is shrinking brain just related to alcohol, or is shrinking brain another symptom of what we're talking about here?
Do you know the answer, Shelley? Shelley is the regional, well, you've got a long title with the Alzheimer's Association. She's the queen of the Alzheimer's Association in Northern California and Northern Nevada.
Well, I don't know about the queen, maybe princess.
Okay.
So I think going to a doctor, and I know it's 8 months is a long time, they probably don't know what's causing the brain to shrink. It could be alcohol, because alcohol will destroy brain cells. But I think that's a case where you need like a diagnostic center like UCSF, UC Davis to really, analyze what is happening. It could be Alzheimer's, it could be another form of dementia. So you can also try, there's the UCSF, UC Davis, Ray Dolby Brain Health Center in this area in San Francisco and over in the East Bay. If you don't want 8 months, try one of the other diagnostic centers and see if you can get in sooner.
Thank you.
Okay, I had a neighbor. Her husband got diagnosed with memory problems. I do not know if they took away his license or not, but he had an accident with his car. The other people were not killed, but there were broken elbows, blah, blah, blah. His car insurance company refused to represent him because he had had a memory issue diagnosis. Is that a common thing?
Wow.
I have
I have
not
not heard
heard
of that,
a situation like that before. The
Shelley?
insurance company, I mean, that gets kind of complicated. I'd have to know more of the specific.
I don't
facts.
know. I mean, I have not heard of that either, but that's the kind of consequence that you're dealing with. If you allow someone to keep their license, as hard as it is, once they are diagnosed, they shouldn't be driving.
The best way to have that conversation with the individual too is around their own safety and the safety of others, rather than, a punish, sort of try and make it a sort of a positive.
And to come up with alternatives for them, like in case, you know what, if I will take you anywhere, or we're going to figure this out together.
Good afternoon. I'd like to offer you some hope on the horizon. My name is Dr. Keely Daniels, and I am very interested in evidence-based research. And the newest, there's a TEDx that you can watch on the use of sound and light with Alzheimer's, and it's extremely effective.
Wow.
And guess what? You can even have those sounds downloaded.
Wow.
It's working with a 40 megahertz frequency. It doesn't hurt. You can't get harmed by it. I personally decided to sign up for part of the research. I don't have the formal diagnosis, but I'm wondering, better? Okay, sorry about that. I'm wondering, are you aware of those evidence-based MIT research with 40 megahertz frequency, specifically for Alzheimer and dementia patients?
I think that I've read an article, but that's about my only exposure.
I thank you for that information. I have not become aware of that, but I'll take a look. I know that music is a great therapy for people. You know, it's a great way to attach.
Yeah. Shelley, you have any info on that? Nope.
I'm sorry, this will have to be our last question.
Thank you for incredibly informative talk. If there's any of us interested in participating in a clinical trial, how do we do that?
It was one of the slides we didn't get to.
Yes.
Do you want to answer?
Sure. The Alzheimer's Association does have a very good system for getting you attached to a clinical trial that might interest you. We call it Trial Match. You can go online or you can call that 800 number and learn how you can find any number of clinical trials that are ongoing at all times. And there are some in our local area for sure through UCSF and other institutions. So thank you for asking that question, because that really, that's a great challenge to find individuals who will be willing to join such clinical trials. That's how those medications get developed.
I just want to make one plug for the big fundraiser, annual fundraiser across the country in over 600 sites. There's a walk to end Alzheimer's. Our walk this year is October 7th at Sonoma State University. It's a half day. It's not a marathon thing. You know, we kind of walk, you know, like, hi, how you doing kind of walk. But it's a great place to connect and support the cause. There's more information on the back table where Shelley is. Thank you so much.
Oh, wonderful. And let me remind you, this program was recorded and it will be available on the Oakmont Lifelong Learning